Becoming in tune with your body. Your body knows best. Whether it's in the functional medicine world or the conventional medicine world, I see patients from both worlds, and they often come to me in a state of overwhelm, maybe confusion. This person says this is an issue. This person gives me this diagnosis. This one gives me this medication. Now I have 10 medications and nobody really knows which one. This doctor says this, the other doctor says no, absolutely not. So there's all of these mixed messages. And even in the functional medicine world, I feel like it's a bit more supportive of each other because there's more commonalities. We look at the whole person versus in conventional medicine, people are just looking at one system. They're not looking at the whole picture of the body. But even in the functional medicine world, I have patients come in and they're on 25 different supplements from 6 different practitioners, and they still have all of these kind of underlying diagnoses. And regardless of the system, they still aren't feeling good. They're doing all of these things, doing all of these supplements, doing all of these practices, or in conventional, they're doing all of these medications, and they still don't feel good. And it becomes that line and balance of taking your health back in your own hands. I'm not saying you don't do what is recommended. Take it with a grain of salt, of course, right? Nobody is perfect. No doctor has the right answer. No practitioner has the right answer. Nobody has that authority of 100%. This is exactly what's going on. Hypothesis, suspect, or guess, or often it's guessing. But the most important thing is your body knows. Your body knows what it needs. It knows what's happened to it over time. And when we get into these places of confusion or overwhelm, or there's all of these symptoms, there's all of these recommendations, I so encourage my patients. I encourage all my patients, right? What do you think your body needs? How can you get in touch with your body and see if you can't get a little bit of intuition or insight into what your body is asking for? Maybe your body's asking for some rest. Maybe it's telling you that you're pushing too hard. You know, maybe someone tells you to exercise more, and so you're doing that, but you're still not feeling good. Maybe you're feeling worse. Maybe the body's like, wow, you're actually in a state of exhaustion. And yes, exercise is important, but that's not what you need at that moment. Maybe your nervous system needs support, and I find that in many, 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 many cases. Maybe the body is telling you, hey, yes, you're doing all of these elimination diets, and you're modifying your diet, and you're being strict on this, but the nervous system is like, I just need a little comforting. I need you to address some of these old trauma issues, or I need you to, support the brain and maybe some negative mindsets as well. So we are not taught to be in our bodies. We are not taught to listen to our bodies. And in fact, it's quite the opposite. What I find personally and what I see in my patients is, medical systems have, when our body gives us a symptom, heartburn, or pain, or anxiety, medical systems are very quick to say, let's make that go away. Here's a drug for your heartburn. Here's a drug for your anxiety. Here's a drug for your pain. Let's make it go away. And what that does is it does not honor the body trying to tell you, hey, I need help. Because there is often always a reason that your body is talking to you. It's brilliant, it is wise, it's amazing. And those signals are its way of letting you know that, hey, we need to adjust something, we need to adapt something, we need to change something because it doesn't feel good in your body. Back to heartburn, do we need to explore what we're eating? Do you need to look at the balance of the hydrochloric acid? Is there a stress component that is affecting the digestive system? Hey, something we need to look at and support. That's what the body's telling you. Back to pain when it comes to mechanical things or even visceral things. Back to, hey, the body's letting you know, hey, there's too much pressure in this area. So is there something we need to support structurally because of old injuries or whatnot? Is there a structural health issue that needs to be looked at? Or back forces that are driving the strain, having the, asking the body, letting you know, hey, this doesn't feel good to me. This can become dangerous. And the sad thing is as many practitioners don't ask the question of why, they're only looking to make symptoms go away. When symptoms don't respond to symptom-focused approaches and treatments, then patients become labeled chronic pain or chronic illnesses or whatnot, where they get thrown on these labels of POTS and fibromyalgia and all of these things. We have to call it something so that they can create a drug to try to help you, right? Those are the options. Unfortunately, especially in the chronic pain world, as people become labeled chronic pain, they are taught it's just in their head. And that further dismisses the body and that body's message. Again, the body is brilliant. It will always tell you what it needs. We just have to start to listen to it and be in tune to it. And how you start that at home, again, most of us have become disembodied over time because our bodies have learned that we don't listen to them. Doctors don't listen to them. They ignore them and they tell them to shut up by giving them medications. So we have to reestablish trust in the body. We have to befriend the body. And we can start to do that by just starting to connect and check in. Even very simply acknowledging that you have a body. Our brains go, and dictate and drive and try to problem solve anything, but there is this wisdom, the subconscious wisdom in the body, in the organs, in the tissues, everything. There's such wisdom there that is so overlooked and ignored. So as we start to become in tune with our body, even just starting to put our hand on our chest and just checking in, or whatever that area that hurts, put your hand on it and check in on it and just let it know, hey, I feel you, I hear you. Let's see if we can gain some wisdom into what it is that you need. Perhaps you can get some insight, or maybe start to ask those next questions into what is the next question I need to ask to support my body? Who's the next practitioner I need to ask to help support my body? And then it becomes a partnership with your practitioner. Hey, what's your body asking for? How do we support your body? Okay, here's what I think with regard to the anatomy and the physics and your history. How can these work together so your practitioner can support your body, you can support your body, but also support your body in the way that your body